Welcome to Healthy Conversations from Athens Limestone Hospital. I'm your host, Susan Claiborne, joined by community hosts Justin Travis and Kim Dunovit. Winter brings extra risk for older adults, from falls to cold weather concerns and chronic condition management. Today, Dr. Phillip Ingram from Waddell Center Family Medicine is here to share simple ways to keep seniors safe and well. All right, well, welcome, Dr. Ingram, and thank you for joining us today. And I know it's hard to get out of the office, but we appreciate you being here. Just kind of give us a little bit of information about yourself, kind of what brought you here, and kind of what took you into the career field of family medicine.
Sure. Thanks again for having me. So getting into family medicine, it was kind of always something that I've had an interest in. I think more just because going through training, going through medical school, even pre-med, there wasn't one thing in particular that I just was obsessed with or was like, oh, that's what I want to do. I would enjoy pediatrics, but then I would think, well, I'm tired of seeing kids all day long. I would enjoy geriatrics, but got tired of seeing senior adults all day long. Surgery, I enjoyed a little bit, but there again, I couldn't just do surgery all day long. So you kind of get a nice variety, nice change of pace, but then I really enjoy seeing people from every walk of life, the good days, the bad days, and all points in between. So I think that's really what kind of led me towards family medicine. I did my residency and last part of medical school in Huntsville, so a little close by. Really enjoyed North Alabama. And then kind of started looking out towards around where to end up, and Athens just kind of met everything that I was looking for. So really been glad to be here and really enjoying it here.
Well, that's awesome. Well, I know we're glad to have you, and I know the Waddell Center is a very busy place, so I know they're glad to have you there too. And I'm with you. I think I would like doing lots of different things too, but obviously seniors are a big part of that. What do you find rewarding caring for seniors?
Oh, absolutely. I think the biggest thing, honestly, is just the life experience. I feel like I learned so much just from sitting down and having conversations with our senior adults. They impart a lot of life wisdom to me just along the way. So I feel like it's a great trade, getting to manage their health. There's several different things going on. So it's always a little bit more in depth. Those visits usually take a little bit longer, just getting to know each other for starters. But two, there's usually multiple things that I'm looking at from multiple systems. So kind of just tackling all that together can be a bit of a challenge, but also a big reward.
I can see that. Um, well, obviously, we kind of wanted to talk about wintertime, where we find ourselves with adults, and so it's very different. So, what are kind of some things that you feel are the most common?
During wintertime, yeah. I mean, of course, the colds, the flus, things like COPD exacerbations usually are going to happen a lot more during the winter. Um, Falls can definitely happen during the winter, but especially the colds as we all have Thanksgiving and Christmas and all the different family gatherings. We share more than just food and memories.
A few germs?
Yes. Yeah, it's definitely what I'm getting at.
So why is wintertime such a high risk season for this
Yeah,
population?
absolutely. I mean, wintertime in general, being a little bit colder, is just mating season for all the viruses. Typically, that's when it's easier for them to reproduce and replicate. So they're pretty active. They use hosts like us to actually reproduce and build off. So wintertime being a little bit colder environment makes it easier for them to do that. But also, our immune systems can get a little bit weaker. The days are getting shorter. We're not quite as active, not quite as out there. So things from every sense, even from the body sense, kind of slow down. So it makes a better opportunity for those viruses to really
Sure.
take off.
Yeah, I hadn't thought about that.
Yeah. So you mentioned COPD just a second ago. How does cold weather affect COPD and other chronic conditions like heart disease, diabetes? How does that play in?
Oh, absolutely. So you can probably ask anyone that has COPD what time of year they're worried the most about, and they'll tell you, yeah, from pretty much as soon as the leaves start turning all the way into the spring, through the whole time. Weather, especially in Alabama, just changes on the drop of a dime.
Snow one day, 80 degrees the next.
Exactly.
Put a tornado in between.
Exactly. But humidity through all that, and that's probably the biggest enemy. As soon as that humidity starts to go up, anyone with COPD or even asthma, as soon as they open the door and get that gush of air from outside, it's like they instantly lose their breath or can start to have a harder time breathing. So that's the biggest thing. Just the weather changes, throw in some extra viruses too. But it really can start to stir up their breathing, make it harder. The cough gets worse. But just even like getting out and getting to their car, getting from their car into the store, it's way more taxing with that environment.
And as you mentioned, changing weather, it can rain one day and then freeze the next day.
Right.
That creates slick environment outside. Talk about that a little bit, how we can prevent falls for older adults.
Sure. Yeah. Yeah, especially with the last few snowstorms we've had in the last few years. We've seen a good bit more falls through those seasons. The biggest thing, I think, looking out, number one, knowing, like, is it a good idea for you to get out and go to the store right now? Can it wait another day till things dry out? Would be the first step. Like, is it worth getting out and all this? If it is, a little bit icy or a little bit wet, look at the forecast and see, all right, is tomorrow going to be a little bit better day? Can I plan? Have I got enough what I need to make it through to tomorrow? Of course, planning, if there's a winter storm coming, getting everything ahead of time, beating the rush for the milk and the bread. But then if you are still getting out, making sure you've got the right, shoes, make sure you've got good footwear to keep those feet dry, number one. But number two, it's got good grip so that it's not going to slip or slide. Something that's actually wrapped around your foot, not just a slide or, your house slippers. Those are just waiting to trip you. So making sure that you're prepared from head to toe.
So comfortability is not the highest thing we look forward to.
No, not exactly. Yeah.
So I should probably tell grandma to put away her Crocs.
Don't wear
Those.
Well, no, even if they're in sport mode, yeah, not the great grip on this.
even in sport mode.
And are there particular warning signs family members should look forward to try and see that?
Yeah, good question. Balance. That'd be the first thing that I'd pay attention to, noticing, is it taking them a little bit longer to get up than usual? But once they get up and start taking those first few steps, are they pretty steady? Or if, you watch their facial expressions and watch how are they reaching for something? Are they already kind of aware of where that piece of furniture is or where that wall is, if they need to brace themselves so that they can catch themselves? That's a pretty obvious sign that you may not be looking for that says, yeah, those steps are not as steady as they used to be. If the wrong thing, be it just even a cold or, a dog running across the house or a loose carpet, were to jump in, could it really throw their balance off like that and lead to a fall?
Yeah, the dogs are definitely
Mhm.
something you don't think about, and I know during the holidays, when you're visiting others' houses and things, for older adults, when they're not used to the children running around or the cat running around or the dog running around, you can really get easily tripped up. I know of an instance, with a cat, because cats are the worst about trying to come and get around your feet, and for senior adults, especially when they're not used to being around them, I can see where that'd cause
Oh yeah.
a fall issue real quick.
Yeah, it can.
Mhm. Dr. Ingram, I want to change gears just a little bit and talk about the temperature. It is so cold outside, and I know I struggle to stay warm. So, as we're looking at our senior friends, what tips do you have for them keeping their homes warm, but still being safe? Of course, like avoiding carbon monoxide or fire hazards, things like that. Can you speak on that?
Sure. And I mean, I think the easiest way to answer that would be to say, well, you can always put on more layers, right? That's what's nice about the cold time of year. You can always grab more blankets. You can always, even if it's in the home, you can always put on an extra sweatshirt, an extra jacket. But at the end of the day, we still want to be comfortable. So as we turn up the heat, just keep in mind, how hot are we getting it, number one. But number two, what sources are we using for that? Whether it's your regular heating unit in the home, if we're adding extra heaters, making sure we're actually looking at that big label that comes attached to the power cord that says, don't leave this plugged in. Make sure it's at least a certain amount of distance between walls and furniture, so that we're not too close to anything.
So those labels actually matter.
Oh, that's why it says don't remove it. And now the one on the mattress we can talk about later, but then the one on those, yeah, it's really important. But yeah, doing a checklist before you go to bed, I think is the biggest thing. Making sure that anything that's still on that shouldn't be needs to be turned off. Make sure if we've actually if we're still doing a good old wood burning fireplace, make sure that it's dying out, it's starting to settle down. Vents are open, chimney's been cleaned if we're still using a chimney. It really needs to be cleaned once a year actually before we start using fires.
So, if I'm a caregiver, Dr. Ingram, how do I help support a loved one that's maybe living alone to make sure that they're warm and safe?
Sure. Um, So, as you're coming into their home, always you want to remember it's their home. So you don't want to go changing everything just right as soon as you see it, shuffling everything around because it can be hard for them to remember, well, wait, where was this? I need this. But just kind of bringing it up conversationally would be a great start. So what are you planning on doing for this freeze warning that's coming through? How are you going to stay warm? Do you have everything you need to stay warm? Can I get you an extra blanket or, do you have good heat? What are you planning to do to heat it? Are you going to start a fire? Are you going to bring out that extra heater? Are you thinking about going out and buying more kerosene, whatever? Just kind of bringing it up in conversation so you can kind of open that door, but then let them answer and give them an opportunity to present what their game plan is. And then you can slide in critiques along the way or say, well, okay, have you thought about, this instead? Can I help you, as far as making sure that you have everything set up? Make sure, that everything's cut off at night. Make sure you're not leaving anything plugged in too long.
I have a couple of friends, and we're both kind of dealing with the aging parents, and so we've kind of talked fairly recently about different things. And I know, your parents have had heaters. Well, they've had these heaters forever and ever and ever. So it's kind of like, okay, great idea for a Christmas gift is maybe replacing that heater because the new ones come with that little. If they fall over, they turn off. Things like that. So replacing some of those older heaters or smart plug, absolutely smart plugs, some ideas like that. And then one of the things we were talking about is needing to get into our parents' medication cabinet and updating it because you don't think about, I know there's always that joke about opening up your parents' fridge and all the dressings that are out of date. Well, it's kind of the same thing with the medication cabinet. I know we were talking about a headache or something, and it was like, well, there's Excedrin in there where you pick it up, and the date on the Excedrin says 2019. And so that was one of the things we had talked about was as the season is getting here, is going in and trying to update some of their medications, making sure they're all
Oh,
in date, the normal stuff, the Mucinex, the cough drops, the throat spray,
okay.
as we kinda got ready,
Oh, yeah,
so
that's a great idea.
And I can guarantee you, being mindful is not just something that older citizens struggle with. Being younger, I struggle with that.
Yeah.
Getting to turn off or blow out that candle is one of the things I struggle with at nighttime. So I get that as well. And we all know that winter can make it hard to make it to those appointments, those doctor's appointments. What advice do you have for managing medication and keeping up with family care during that season?
Oh, absolutely. We always have, usually same day availability for appointments if we need them. But, still ice storms can happen. They definitely did a couple of years ago. So you can, always call the clinic is a great start, for our office. We do have even after hours available as far as phone service if we need emergencies or need help. But even then, if we were, not in the office or not able to get to a patient, I'd still want to know about it. I've always as long as I can get to an internet connection, I can access referrals or send in refills if needed.
Absolutely. And then how can programs like our hospital's Meds to Beds program or partnerships with local clinics help ensure community care?
Yes. Oh yeah, absolutely. I think the biggest thing is just making sure that everyone has exactly what they need, but being a little bit more proactive too. I always find it frustrating when one of my patients has ended up in the ER or in the hospital, and I think, oh, I could have done something first. So staying proactive, I think, is the biggest thing. Absolutely.
yeah, and I think, again, it's one of those as a caregiver for, an older parent, it is, when they well, fluids, I don't know what you see in your senior adult population, but I know with our parents, getting them to drink enough fluids in the winter, and they're not outside, they're not moving as much, so they don't really think they need it, but yet that heat in their house, the heater in the house, and still just daily, they need those fluids, and so we've kind of tried to implement some additional, with the little hydration packets or I can't think of the other name of the drink that we Pedialyte, yeah, some of those different drinks that we've tried to kinda implement in the winter because we do realize that dehydration has kinda been one of the things we've noticed
Right.
that
Well, and the
so
biggest thing, yeah, when you say fluids, the doctor in me has to make it clear the right fluids. So what you're saying, electrolytes, water, it's not Cokes, it's not sweet tea, it's not, hot chocolate even, since we're getting closer. Um,
we should have kept a little chalkboard on all these episodes on how many times a physician comes in and says,
Okay.
"No sodas."
yeah.
There's nothing good ever said about sodas.
No, but they're sweet. They taste wonderful. Don't get me wrong. That's why we all drink them. That's why we all like them. And I mean, I'm not just can't get rid of it altogether, but still, I think the biggest thing we forget or don't think about is that there's caffeine in most of these. They're going to actually dehydrate you. So we're going against, you think, oh, well, I'm drinking something, I'm hydrating, but actually you're not. So you need to replace a little bit more water, a little bit more electrolytes.
Well,
Keep an eye on the caffeine.
definitely, I think these small things can certainly add up to, like you said, preventative care before it gets to that point. And that was kind of the fault, between talking about our seniors and winter is there are a lot of small things that we kind of overlook that we can address and help with our seniors. Well, kind of just as we close today, I know the Waddell Center works very closely with the hospital. We've kind of got a great relationship and partnership there. So, what other message would you just kind of like to leave with us to kind of talk about our seniors or their loved ones or kind of how we can support our seniors?
Sure. Um, I think the biggest thing is, making sure that we're staying active. Um, if from our clinic side of things, we're always happy to see our patients. But the biggest thing is making sure that we're keeping up, with our regularly scheduled appointments. Those AWVs are always crucial from our side. We want to make sure that everybody's getting their annual wellness visit for the year. But that's kind of our big time to sit down and actually go through a lot of the stuff that we've talked about today. So making sure that we're getting that annual wellness scheduled. I know we're always kind of bugging, and a lot of patients are probably hearing this going, "Oh, but it's so much work. There's all these extra questions. They always get all, it almost gets personal with how much information we're asking. But that's our time really to go through a lot of this and make sure that everything you need is already in place. There's nothing else that we could be adding or doing differently. So that would probably be my biggest plug is make sure we're keeping up with those annual visits.
Yeah. And not all seniors have a support system. So, that's that opportunity to have someone else that's kind of looking after them and kind of guiding them. So, that's awesome. Well, thank you so much for
Well,
taking
thank you
time
for
today to be here. We really
Yeah,
appreciate it.
absolutely.
We are so appreciative of Dr. Ingram being here today to share some practical advice to help our seniors stay safe this winter. And thank you to our listeners for joining us. Let's keep talking, learning, and growing toward better health together.